So good morning, Dr. Raakil. Thank you so much for your time and cooperation. And you are the director of the Alternative to Violence Center in Oslo, in Norway, born in 1987, and considered the most important center at European level in the treatment of men author of violence. As the metropolitan city of Bologna, we think that your precious contribution can make this November, the 25th, 2020, truly significant. We would like it to become a forerunner for an exchange of comparison and sharing, along with great international experiences like yours, on this issue that is sometimes too overshadowed. In order to continue working with commitment, dedication, unity, and a broad vision in the fight against gender-based violence. Starting from the reference context in which it bore the center, I would like to ask you, what allowed its creation? How has it grown over the years? And what organizational structure does it have today? Thank you.
Thank you, Christina. First of all, I would also like to thank you for the invitation and the possibility to participate in the city of Bologna's marking of this important day, the 25th of November. I would also like to say that beside being the executive director of Alternative to Violence in Norway, I'm also educated and trained as a specialist in clinical psychology. As you said, Alternative to Violence, which we call ATV in our daily language, was born in 1987. At that time, it was the first professional treatment center and treatment service for men who use violence in intimate relationships. And it's a good question you ask, I think, about what allowed the creation. And the history is actually that the main creator of this center was a woman. Her name is Kristin Skjørten. She's a criminologist and a very accredited researcher today. Back in the 80s, she was a student studying criminology, and she was also working in the first women's shelter in Norway, which was situated in Oslo. And at that time, there was a slow emerging of focusing on men's violence against women in the society. The first decisions about making a research program concerning this was emerging. The government was slowly starting to addressing this as a problem in society, and some of Kristin's reporting on the beginning and the process behind Alternative to Violence was that she, as she worked in the women's shelter, both the women at the shelter and the women working at the shelter was talking about these men who used violence, but no one had talked to them. So her thought was that we, in order to do whatever we can to stop violence against women, and or by that also trying to combat this as a problem in society, she thought that we have to do something alongside supporting the women and the children, and provide the kind of safety that wasn't in place in any respect at that moment. So she thought that we need to also try to work with the men who use violence together with the work that we do to support the women and children. And she went on a study trip to the United States. They started their first centers for men using violence 10 years before we started in Europe. And she was visiting the Emerge Center in Boston in Massachusetts, which was the first American center that started 10 years earlier in 1977. And she got some recommendations from one of the founders, Mr. David Adams, about both the necessity and the significance about on how and why to set up a center working with the men. And she took those recommendations with her back to Norway, and together with Sigmund Karterud and Tor Christian Island, two psychiatrists, and another male activist called Christian Magnus Falsen, they applied for project funding to try to test out this activity. And they got the project funding from the Minister of Social Affairs in Norway, and that was actually the beginning. The main person that is behind the very start of Alternative to Violence is Kristin Skjørten. And there's a staff of 90 people, and the only assignment we have is to work with violence in the family, men's violence against women and children. So that's a few words about the organizational development. We started out working with men, and we were only working with men in the beginning. After short 15 years, we also started to work with women who had problems with aggression and violence. And of course, this didn't challenge the fact that violence in intimate relationships is a male problem in society. But it reminded us that on the individual level, there are still most men who use violence, but it's not the problem reserved for men. It's also some women who struggle with this. And that also helped us with challenging the theoretical ideas and how to make a nuanced understanding of what violence in intimate relationships is about. The next developmental stage was that we started to work with also women who were victims of violence, survivors of domestic violence around the millennium shift. And in the same period, we also started to work with children. Our main driving force was that we were curious about what are the true consequences and effects of the violence onto the victims. And in the same period, we also started to work with adolescents who had problems with violence. And our main motivation for that was that quite a lot of, most of our male adult clients also reported that they had problems with violence long before they became adults and before they engaged in intimate relationships as adults. So we thought that also working with adolescents who had problems with violence could be a kind of preventive work, in the sense that if we can help them stop using violence as a strategy and as a behavior, that may, in the best case, that would also prevent them from being abusive in their adult intimate relationships. So by the millennium shift, we had broadened our practical work and clinical work to include all members of the family, and also not at least the adolescents. And the last 10-15 years has been also in our organization very much about exploring the complex reasons for developing problems with violence, exploring the causes of violence, and which means that the original idea that violence is about patriarchal attitudes, about masculinities that are partly unhealthy, in the sense that valuing masculinities that is entitling men to be dominating and abusive to women, has to be challenged and has to be addressed, of course. But we also found through our work with our male clients that, as our research shows, that the majority of our clients also experienced violence as kids. They were witnessing and observing and part of their father's violence against their mothers. So we have had from the start in many ways, and with an increased belief in the importance of also addressing their men's personal life history and exploring their experiences with violence throughout their lifespan has become important. So in many ways, one of our main mission is to combine the analysis focusing on society and culture and male sex roles related to patriarchal attitudes. We need to combine them with also looking at what are the psychological factors in this. We think our experience is that we need to look in the intersection of society and culture, and with also the personal life history of our clients, in order to understand more about the causes of violence.
So now I would like to focusing about the approach that you decide to adopt to act on the phenomenon of men author of violence. What is your approach?
We did in the beginning, when we started Alternative to Violence, we were young male psychologists that were running the organization. We were only the three of us in the beginning. And at the very start, we all, of course, had the discussion around what kind of treatment programs and what kind of methodology should we adopt and apply in our work with men who perpetrate violence, because that was our specific assignment. We shouldn't provide psychotherapy in general. We should try to develop ways of working with their problems with violence, most of all. And our training at the university had, we were trained in family therapy, in cognitive therapy, in psychoanalytic therapy. And we, of course, had discussions if we should be a center that was providing one or more of these basic methodologies that we had been learning about in our education. And I think we made a very important strategic decision in the very beginning, in the sense that we decided that we should wait with the decision on methodology until we had met our clients, because we didn't learn very much about how to address men's violence against women and children as a part of our training in family therapy or cognitive therapy or psychodynamic therapy. So we read the few books that was written by that at the time, and we met our first clients, first of all, with a curiosity on how the violence, what the violence looked like, how was the problem of violence with each and every one of the clients. And on this basis, we decided to try to make our own methodology. Of course, we were picking elements from different established treatment methodologies, but we thought it was important to try to really make a designed methodology that was addressing the violence first of all. And that is also still flavoring and characterizing our way of working with the adult persons, the men and the few women that perpetrates violence. The main characteristic of this ATV model that we have made is that we need to address the violence in itself, really mapping the violence and go into the details of the violence in order to make a very realistic picture and description of the violence. That has to be the basis if we are going to change their behavior on violence. It's quite explaining, I think. What is embedded in this is that we didn't follow the ideas about that if we can repair or treat the background factors about difficulties in life earlier in general, that would make the violence stop. We thought that we have to explicitly address the violence and focus on the violence as the problem it actually is. It is about, it's of course connected to life experiences. Like, for example, if you have experienced violence at home as a child, we need to address that as a part of the treatment, but that is not the cause of the violent problem with violence in itself. And we also experienced what was described in the books we had been reading about that our clients had a need and a tendency to minimize the violence, to blame others for the violence, etc., etc. So we also quite early understood that we have to work on the men's sense of responsibility, because our one important perspective we had was that these men have to take responsibility for their violence, and they are able to take responsibility if we can help them on the way. So the history of alternative to violence is also a history of trying to provide specific methodology that is addressing the violence specifically, and that is also characterizing our training and cooperation with other agencies, also in Italy, as we cooperate with different agencies like the LDV offices, and also the Senza Violenza in Bologna. And so we are still working on developing our model because it's not perfect. The basic perspectives and the basic assumptions are still very important, but we still need to develop it and make it more nuanced, if I could put it that way.
And so what kind of interaction and collaboration is there between your work and women's association that fight violence against women?
I think we would have an even more structured collaboration with the women's associations. But we also ourselves work with victims of violence, as I told you. So that is an important part of the picture. Still, we have a different kind of collaboration with the women's associations. The women's shelters, we sometimes have project cooperation. In some of our offices, we are also serving the women at the women's shelters in a collaboration with the women's shelter. And in Norway also there's a great focus by today on the children living in the families, experiencing violence in their upbringing family. And an important part of the Norwegian public structure is also a well-developed child protection service structure. So we more and more we have a structured collaboration with the child protection services in order to contribute to the safety of the children and their mothers. And so we are, I think we are quite proactive in cooperating both with the women's shelters and the public support services for women and children. And I think also it's important to say that there has always been an extremely good relationship between the women's shelters in Norway and Alternative to Violence.
Okay, thank you so much. And what impact has your work had on society over the years, and did it bring about significant changes? What do you think?
In Norway, there has been an increasing public focus on violence against women and children as a problem to society. By today, it is very high on the political agenda, both locally but also nationally. And together with the other agents like the Women's Shelter Movement, like the National Research Center on Violence and Traumatic Stress, I think especially the last 10 years has been in many ways characterized by that the politicians has been listening to the research field and the agencies like the women's shelters and Alternative to Violence in how they have been forming their political strategies. So the government in Norway today say that they have developed a policy that is informed, that is based on the knowledge we have around violence against women and children, and a very strong example that we the different agencies have had an impact on the development in society is that on the basis of our dialogue with the government and the politicians, addressing this as a problem to society, sharing the emerging knowledge, all we know about the impact of violence to children's development, to the life situation of women. A very significant result on this concrete dialogue between the experts and the politicians has both been that there, since 1999, there has been national action plans hosted by the government, which is also committing the government to take measures and take the problem seriously. And in 2017, the Norwegian Parliament, across parties, all parties supported the decision on an escalation plan, which is a stronger measure than a action plan. And this escalation plan was the basis for an increased initiative nationwide in terms of resources and funding into research, to strengthening the support services for women and children, and strengthening the treatment services for the men who use violence. And it was a substantial amount of money that has been put into this work since 2017. So I think really that the agencies, especially the women's shelters and Alternative to Violence, has had a positive impact on society and on public policy.
Okay, thank you so much. And has the phenomenon of mental violence worsened due to the pandemic we are experiencing? In your opinion, what future do you envisage in the light of all these unexpected changes?
That is, of course, an extremely important question. And with reference to the COVID-19, we have half a year's of experience with this pandemic in the world. It is difficult to very precisely say in what way it has worsened. But there is the main experience and the main picture is that there has been an increase in intimate violence in intimate relationships. Still, of course, we need more data on comparison. How was it before the pandemic, and what is the national level in different countries 6-8 months into the pandemic? There are quite a few countries that don't have the national surveys done before the pandemic. Norway did that in 2014, but still we haven't done a replica of the same study, which we could do, and maybe we will do. Maybe the authorities will decide to do that. But at least if we look into the UN, I was attending a webinar hosted by the UN Women, where they presented global figures reporting that there has been approximately a 30% increase in domestic violence. So, but the main point is that the risk of violence increasing in times of pandemics, that is we should rely on that knowledge. Of course, it's quite a short way to then think that with the very strong risk of increased problems with violence in society and violence against women and children in society, we should, of course, nationally and also internationally, we should increase the efforts, which is quite impossible to do if not then the governments of each country is providing more resources. So I think it's a very clear and common recommendation that in these pandemic times, resources and priorities targeting and focusing on violence in the family, men's violence against women and children should be increased. That would be the only reasonable thing to do, because we know so much about the consequences in general to the victims of violence in intimate relationships and family, and those harming consequences are of course only increased in a situation like this. So we have been recommending our government to increase the efforts, and I really hope that the governments of all the European countries are doing that, and because it's not just a very good investment, but it's also a very important and necessary investment.
Thank you. I think you are an example about that, Norway, yes, for all other countries. And I have just one more question, if it's possible.
Yes.
Very short is my curiosity. Did you see families resolve completely this problem in a long time and become happy?
Yes.
Okay.
The research, of course, it is a special thing to just state yes, and of course there is a nuanced picture in the sense that some families and some men don't change, but the research that has been done on our work, the main result is that investing and applying help is making a significant change when we talk about research. And in the research terms, this is quite promising. It's not perfect in any way, but it's this is going well along our experience that it's not a quick fix. But as long as the men get help, as long as they take this problem seriously, as long as they really make this a personal project to change and take the violence seriously, then you have a very good basis for change to happen.
That's wonderful, because it gives to us a lot of hope and yes, for the future. So thank you so much for your time.
Thank you very much, and I hope that what you do on the 25th of November in Bologna and the metropolitan city of Bologna is reaching out to large part of the public, because that kind of work is also extremely important.
Absolutely agree. Yes.